I recently had a viewer ask about patient rights and phone calls and all that. So in this video, I want to talk about phone calls as it relates to patients in a psychiatric or inpatient setting. So first and foremost, every patient that comes into a psychiatric ward, they have a right to call pretty much whomever they want to, unless there's some sort of restraining order. It is considered a basic human right to make phone calls. And when I worked at the state hospital, especially in the state hospital, I felt like we were a little overly restrictive on phone calls, and I felt like it actually was to the detriment of the patient. But I will say that generally speaking, a phone call to someone on the outside is very therapeutic for a patient because they feel like they can talk to someone who knows them, who hopefully loves them, someone they have rapport with. And then at the end of the phone call, hopefully they feel heard. They feel like they've made a connection. A lot of times what happens is you'll get patients who come into hospitals. They don't know anyone. They're a little psychotic. They have a hard time understanding reality and they feel isolated. And so making that phone call can decrease the amount of isolation they feel. Generally in a psych ward, the patient will come up, they'll ask to make a phone call. Staff will dial the number for them and then they will transfer the phone call for the patient. I worked in one place where we would allow the patient to have a mobile phone that was on the unit. You know, when you just take it off the stand, they could dial the number themselves. The only issue with that is sometimes they will dial numbers inappropriately. They might call the police, the fire department, AMR, whatever, unnecessarily, or they might sit there and dial the same number or try to talk to the same person over and over again. So there can be some issues with that. So if a patient needs to have their phone restricted for either legal or therapeutic reasons, the only person who can do that is a doctor. So the doctor has to write a note that restricts the phone call, and they have to give a reason why they're restricting access to the phone or why they're restricting the patient from calling certain people. Another thing that I would do as a nurse, whenever I would dial a number, I would say, hey, I've got a call from so-and-so. Do you want to take it? Because if the person tells me no, then I'm going to say, look, we dialed it and so-and-so said no. And I feel like that's just being respectful of the person on the other end, because a lot of times people in a psych ward, they feel like they have nobody. So they're wanting to call that person 24/7, like 3-4 times an hour, and that's just a little excessive. So when might staff sort of restrict a phone call without a doctor's order? And this is where I feel like it's a little gray, but let's say you've got a patient who wants to call someone 6 times in an hour. That's a little excessive, right? Why wouldn't the phone conversation just last a longer time rather than them ending the phone conversation, reinitiating it, ending it, and so forth, right? So in that situation, I would just say, look, you made 5 calls this last hour. Let's wait until, and I would give them a specific time, like maybe in an hour or 2 when they can call again. Staff, I believe, do have a right to limit phone calls to a certain degree. Like you probably won't get a phone call during groups. You're probably not going to get a phone call when you should be participating in some sort of activity. But this is definitely an area where staff has to be kind of careful, because you really cannot restrict the phone, access to a phone, without a doctor's order. Another thing I want to mention is that although I've seen phone calls be very therapeutic for patients, I've also seen them be very untherapeutic for patients. And if there's a pattern where a patient will call someone and then when they're done with the phone call conversation, they're just agitated, anxious, inconsolably crying, things like that. And usually what I'll do is I'll say, look, Jessica, I know you want to call your boyfriend Mark. Tell me about your last conversation and how you felt after you were off the phone. And I try to just get them to have a little bit of insight as to why it might not be the best time or the most therapeutic thing for them to do in that situation. And then really, if it becomes an issue, I would probably just restrict and say, look, you called them an hour ago. This is what happened. Let's give it until 2:30 before you want to call them again. And then maybe even working with the patient to come up with some guidelines for how they're going to manage hearing something over the phone that they may not want to hear. And then if that doesn't work, then I would just notify the provider and say, look, this is what's happening. The patient calls their boyfriend tells him that he hates her, and she becomes tearful, irritable, she starts breaking things in the day hall, etc. And then hopefully we would get a doctor's order to restrict that phone call. All right, I hope that video was helpful. I know it's just completely discombobulated. I initially recorded this video was much better, not that it was great, but then I realized I did not have my microphone on. So hopefully this video answered your question.